Now, this webinar is sponsored by Hollister Incorporated. We're very happy to have with us today Louise Samuel, better known as Sam. Louise Samuel is a nurse at the Jewish General Hospital for now 27 years. She spent the first 10 years working in the cardiovascular, maxillofacial, colorectal, and general surgery departments. 2007, she graduated from the Canadian Association of Stoma Therapists Oral Therapy Program. Sam is the Francophone academic advisor for the ostomy component at the Institute of Wound, Ostomy and Continence Education. She's also a member of the organizing committee for the National Wound, Ostomy and Continence Nurses Canada, and she is president of the Association of Nurses of Stoma Therapist Nurses in Quebec. Over the years, she has participated in numerous wounds and ostomy care advisory committee, presented at the ISPSCC National Conference, and facilitated webinars as well. She's also mother of an 18-year-old hockey lacrosse player and a 15-year-old dancing girl. She has a lot of energy and likes to get involved in many projects. So she will be sharing with us today tips and tricks to successfully managing your ostomy. So, Louise, Sam, the floor is yours. So, good evening again. The objectives are to recognize the different types of stoma, familiarize with the different types of equipment, with the various accessories, and understand their use. We'll also have an overview of tips to make life easier and recognize the most common complication and be able to treat them. So first, recognizing the different types of stoma. Stoma means lungs of the intestine. It's a surgical opening made to create an artificial passageway for the evacuation of body waste. There are many different size and shapes, and there's no sphincter, so no control over evacuation, and it requires a bag or a pouch. So it is to manage incontinence. So with a bag or a pouch, it is possible to manage the voiding and have a better control on the protection of the skin and a better control on the odor as well. So the stoma will offer a better quality of life instead of wearing continency devices. So there are gastrointestinal stoma. So the colostomy, and the reason why I'm making the difference is that now we have access to a whole set of information on the web and a social network, and often the people do their own search. And sometimes I think that it's not the same thing or it doesn't apply to them. Now, it's important that when you do your own research, you have to compare apples with apples. So do the proper research. So they might visually be the same, but the management is different. So colostomy means on the large intestine or colon. So there are 4 parts in the intestine, in the bowels: the ascending, transverse, descending, and sigmoid. So depending on where the stoma is, there's going to be a difference, because the work of the large intestine is to absorb water. So depending on where the stoma is, its function will be different. So there will be also the presence of gas, because there are some bacteria, but it's possible to decide to wear a pouch that is disposable. So each time that we void our bowels, so sometimes it might become very expensive, or if it's less often, you can have a disposable bag. Sometimes the patients would use a disposable bag in special situations, like in holidays, but at home with a reusable pouch. There was one patient who said she was invited for supper and she didn't feel comfortable throwing her bag in the rubbish bin there. So those are different options. So depending on the patient, the options are various. Then you have also the ileostomy. Ileostomy, when you're making researches, ileostomy is something very different. It drains 1.5 liters a day, very acid stools, almost no odor. So it's completely different. And the third type of stoma is the urostomy. So when we have a problem with the sphincter or the bladder and we have a difficulty in controlling it, there's a way, there must be a way to avoid it. So we need a conduct and basically a duct to avoid the urine. So take a little part of the small intestine and it's used to avoid the urine. So again, it's mucosa, and that's why we call it urinary stoma in case of urostomy. In the picture, you see a little drain, but this drain is taken out 10 days after the surgery. I also added that piece. It's important also to make sure that you have the financial assistance you're entitled to receive. So for each stoma, the program grants an annual lump of sum. So it's important that the patients know if you have a permanent stoma, it's $1,298. If it's a temporary stoma, it's $865 in 2 installments of 406 months. So it's important if you assume the cost, it's important to keep the invoice, the bill, and then you ask for reimbursement. Many patients forget that they have access to financial assistance, and you can go on the website of Ostomy Canada, and there's a lot of information and also a pamphlet published by the association, and also some aid to fill out the form. It's so it's important to make sure that, well, to go and get that funding, that support, because you're entitled to receive it. The paper or the form has to be filled and signed by your doctor. You can get some help also to fill it out. Very important to go and get the money that you're entitled to receive. Now, the characteristic of a normal stoma: red and damp. Ideally, it should protrude out of the skin. Now we're all different. All have a different anatomy. Some have a larger or smaller belly. So sometimes because of the surgery, the stoma will be different. There can be 1 or 2 openings. In general, there are the stoma has 1 single hole. In some cases, especially the temporary ones, they have 2 holes. So what is important to keep in mind is that the peristomal skin must be intact. It's not normal to have redness, and you shouldn't live with that. When you have fecal or urinary incontinency and there's redness, often we try to clean, and it's exactly the same thing with stoma. So this is just to illustrate the construction types. So a stoma is kind of so the skin, basically. Now, the different types of equipment, you have a 2-piece system or a 1-piece system. It's a personal choice. You have the bag with the collar and the protective field or the skin barrier with the collar. So it's like a Tupperware in plastic that makes the bag adhere to the skin barrier. And it's always easier to open it when you passing gases. So some people prefer the one-piece system. Everything is stuck together, and they find it's easier, and they're not bothered to pass gases. So often the people ask me, is there one better than the other? Well, it's like people who prefer boxers or different types of underwear. So it's a personal choice. They're both very good. So one piece or two piece is really a personal choice. Same thing for the pouches. Some pouches are reusable. You can empty them and reuse them. Some are transparent, other are opaque. Some people prefer seeing, others no. They can be with filter or no filter. Filter allowed to filter gases. So it's a carbon filter. So the air will go out, but not the odor. And then there's also the closed bag. In that case, it cannot be emptied. It has to be disposed. Some people prefer that solution. And for urostomy, it's a different pouch. There's a valve in the bottom, and they cannot be exchanged or that's not exchangeable. So the valve one is the one for urine, for urostomy. So you cannot replace one with the other. So when you lay down, the urine won't go up. So the pouch is made of different layers to prevent that reflux.
Now, if we look at the skin protectors, we have several choices. It really depends on the belly and our abdomen and the type of stoma that we have. And the one that we have on top is the flat one, and the other one is convex. It's a little bit like a plate, and there's plastic, and it's rigid. Why one and not the other? When we have a nice stoma like this and a small a belly that's if we have a stomach like this, a belly like this, and we have the stoma looking like this. So if it's convex, then it will push on the belly and the stoma will actually protrude more. So the idea is always to have it protrude a little bit so that the stool can be projected in the bag. So the two stomas, right and left, I call them with a smile. You see the different folds. So when we are in the field with stomas and when I describe them, I use the clock. Like I have here a fold at the 3 o'clock and 9 o'clock. So this convexity allows me to cover and stop the stools to go out. So now if we look at the skin protectors, we have another choice once we've decided if it's convex or flat. We have choices like in a restaurant menu. So there's a small hole that we can cut as much as we want. So it's practical because some of the stomas are not round, some have a little bit of a bump. So here we can cut, and it's important when we buy to buy the size that we need. And you can see here there's a size on the label here. And then we have the pre-cut. Uh, some are flat up to 44 millimeters, and the convex go to up to 51 millimeters. So it can be we can buy them pre-cut. It can go 32, 35, and the round is already made. So then there's with or without borders. Uh, I won't say it's a more of a brown, but it's more of a pinky and it's adhesive. So, but some people have allergies. I do a lot of allergies to adhesive. Maybe I would not tolerate this. So this is the same kind of appliance that exists without borders. So we have the choice. So it's important to measure the size and in order to select the right one. Now we will familiarize ourselves with the accessories. And this is why I put a toolbox and a question mark, because we want people to be autonomous if they have a permanent stoma. I'm there to help my patient, but very often they don't want to come all the time, right? They want people to want to try to solve the problems by themselves. So I will give you tools to manage the different issues. I don't use a lot of accessories with my patients, but accessories are there when we encounter problems, and I'm happy to have them. So the idea is not to use them all at the same time. The idea is to improve the comfort so that the skin stays intact, and it's very often to solve problems and to improve quality of life. If we have no leaks, we have a better skin and better quality of life. So the first accessory we have is paste. It's not glue. It's not an adhesive. It doesn't create adhesion. So it's really for the round brown. So the paste is something that is like a seal around the projective field opening near the stomach, and it won't. So it's really stopping the water to seep in. So here it's really to fill in the gaps and the little inequalities and uneven skin surfaces. So it will discourage the stool to go out. So sometimes I have patients telling and saying, "Yes, I will put a lot of paste. It will glue. It will glue in, and then they put so much. It's on the abdomen and in the as we say in Quebec, it will all like be mushy, mushy, and it won't glue and stay there for 5, 6, 7 days as it should. So it's really putting a little bit at the opening of the skin protector. And if we have a urinary stoma, we should not use it. For some, the clumps and paste can actually block. In those cases, we will use a ring, flat or convex, and it's the same thing. It's like a seal. We can make it bigger around the stoma. I can actually uh, also use put the little bits and pieces and break it and put it in the little holes. So it depends on the dexterity of people, and it's more resistant actually to erosion. So for people who have issues, very often we'll use more the ring than the paste, but they have the same principle of make uneven surfaces more regular and to avoid leaking. So and also there's the stoma belts, and very often we will use a belt so that the appliance stays in place well. So it should be well adjusted, but not too tight. We have to be able to put 2 fingers between the abdomen and the belt. So some people will wear it when they're very active and they're doing sport or running. It's really a matter of choice. Here you have a picture on the left, we have a stoma that's quite deep, and I would need a convexity and I need an appliance. So I put a belt to this patient. The next accessory is powder, the stoma powder. Very often patients leave with it, and it's like really the first aid kit. There's not much we can do with cream and lotion around a stoma. So the first thing we use is powder to manage moisture. So it's like if it's like full of little sponges in a bottle. So if we have irritation, we have some moisture for some reason, and it's like a burn. First of all, it's very painful, and it's like sweating. So it's hard to have adhesion and to put anything. So if we put this powder on the rash or the red skin, then it absorbs humidity. So very often what we will do is, okay, change more often, even if we put powder. But I did underline something on my slide, why we have to find out the cause of this moisture, because this is like powder is like a plaster, right? We have to find out why it happened. Is it because of the stool? Is it something that's recurrent, that's happen only once? We have to find the cause of this moisture. I put three other pictures here. On the left, we have redness, but it's dry, so it's pressure redness. So I have a very sensitive skin, so I probably at the end of this webinar, I will have some redness on my thighs because I was sitting for a while. So it's the same thing for some people using appliances, and we take it away when there's redness, and then we take off, and it's fine. We saw no need for powder. On the right side, we see a healthy skin, so we don't need anything there. No powder, nothing. If it's fine, we have to be keep it simple. So if things are going well, we don't need accessories. So we use powder only when we need. These are tools that I give you. It's not things that you should be using every day. There's also like the solvent remover in spray or in pads. You know, sometimes when we have something stuck on the abdomen, and there can be some things around. This will remove adhesive residues, facilitate removal of the skin protector. People who have a very, very sensitive skin, it will prevent this. And I can use this with people with heavy pilosity, so we don't tear um, the hair. And also, it's useful for people with heavy pilosity and folliculitis. For some people, uh, it's a problem with young girls who have very, very fine hair, but they have this folliculitis. The next is protective skin pads. I use them very rarely. It's really to create a protective film on the skin. It was really in fashion in the year 2000. We used to use it all the time, and we realized at some point it was not that good, actually, especially people who have skin protectors for long term. I use it, for instance, when it's very, very hot and the patient sweats a lot, then it will help. Otherwise, it's not something that I will use a lot. Now, the strips, this is really to buy time because these things are not all covered in Quebec, for instance, and this quite expensive. So people who do a lot of use sport. So the elastic barrier will stop. So some people will run in the morning and they will have a shower, and very often these strips will allow us to use our equipment a little bit longer. Now, deodorizing lubricant, to eliminate odors and facilitate bag emptying and drainage. I use it more as a lubricant for people who have a colostomy. Sometimes it's more difficult to get the stool out. They're more milky or pasty. So sometimes after drainage, we put a little bit of a lubricant in the back, and the next time we drain, the stool may ease with more ease come out. There are also odor eliminators for the people who really have a difficulty with odor. So these are drops that we put in the bag, and they're also in aerosol, and this is really to eliminate the odor. So there's no odor. It's like a vaporize. So the drops will neutralize the odors. It's not like Febreze. It's something that doesn't.
So all those advices, well, I apologize. It's a little bit fast for the interpreters. I apologize. Thank you. As I said at the beginning, I'm from Gaspésie. I tend to speak very fast, so I'll try to slow down. So all those advice can be found on the Hollister site, website. All the pages are there in French and in English. And if you have a stoma, maybe you're not using all the devices, all the other things of Hollister, because they all have rings or two pieces, eliminator. They all offer, all the companies offer this type of devices. So after all, it's all the same, but it's just produced by different companies. So no matter who's manufacturing them, it's the same principle. So I'll do a quick overview of tips to make life easier with a stoma. So I have a son. He's 18 years old and is very active. He's a player, hockey player. But if he had one, he should wear a protector like this one, because the stoma is mucosa. It's like in the mouth, so there's no nerve termination. So there's no sensation. So when you're playing soccer, football, anything, if you receive, if you get hit on your stoma, you wouldn't even feel it. So that's why it's important to wear a protector that is put into place with a belt. The other one is a Lycra pouch, and people find it's very practical when they are practicing sports, even for sleeping, because sometimes when the people move and move on this and try to sleep on the side, then the stoma might move. So some people like to have a support for the pouch. So you have this type of system that help you feel free and be comfortable. So there are a lot of blogs on people who have stoma, and you can practice sports, you can go to the beach. Some people are not too comfortable going out with the pouch. For others, that they're okay. For women, it's easier to hide the pouch. For men, it's a little bit more difficult. Now, if you want to wear a swimming suit, often for men, the stoma is higher at the top of the belly, of the belly button. So if you put a belt, it's like increasing the size of your swimming suit, making it a little bit higher, that's all. So it wouldn't even appear. So you have many little tricks. Then the night drainage bag tip. When you're using a pouch at night, you can simply put a hanger between your mattress and your bed, and so you can hang your bag. And a plastic hanger will do the job. Then tips for reducing gas. Stoma or not, anyway, some food will cause gas, so you have to try them out. Some behaviors also contribute to an ingestion, like chewing gum, or drinking with straw, drinking carbonated water. Now there are a lot of different drinks, soda stream. So people tend to drink a lot of carbonated water. And then there are things on the market, products like anti-flatulence. In special circumstances, you're going out to theater, you just want to make sure that you have no gas, that you're not passing gases. So it could be helpful. Or leaning on a counter. So when you put your hand on the stoma, usually it will kind of muffle the noise. And the food also that help reduce odors. It's been 27 years that I'm a nurse, so I've seen all type of stools, no matter the nationality, the language, the skin color. It never smell roses. So stoma or not, when you have stools, it smells. So some people are not comfortable emptying them in a public space, in a public bathroom. So sometimes you can use foods that reduce the smell of stools, like buttermilk, rice pudding, yogurt, cranberry juice, and also some products like bismuth, sucralate, they're from tablets basically. And again, people do not react the same way to the same food. I've presented that as with the English term, because we don't have a real French term for the pancaking effect. So basically, the stools will all accumulate under the skin barrier. So tips, check if there's a filter, because sometimes it will create a vacuum effect. When you applied your pouch, did you insert some air, because it takes air so that the stool can get into the bag. Also increase the intake of water, or adding lubricant in the bag. Lubricant in the bags, or increase fibers like fiber diet, fruit and vegetable. Also check the fat intake, because some people have more difficulty in digesting them. When there's too much fat in the stools, they become very sticky. So they will form that kind of pancaking effect in the bag. So people will try to make the stools more soft and less sticky. Then it's not because you have a stoma that you cannot travel. You just have to get organized. You can keep on living and traveling just differently. So you bring all your system, calculate for systems a week, and also take more than what you need maybe. So if you're going to a destination, it's important that you have a minimum with you. So keep in mind that when you send them as checked luggage, it's very cold. So it's better to take them with you. Then when you're in the plane, you could have a little bit more gases. So it's always better to sit closer to the washrooms. And pre-cut also your barriers, and also bring a list of everything that you need, and check beforehand if there are some sellers for your equipment over there. So sometimes you might end up being stuck somewhere because of the plane that doesn't take off. So it's always good to have a backup. And there's also a beautiful traveling passport that is available. It's available in 6 languages, to explain basically that you are carrying a stoma. And if you have a body search, nobody should take away that bag. So it's very well explained, and it's kind of a good thing to take it with you. Now we're going to look at the most common complication. So when the skin is healthy, all is good. So what I showed you before, the little bit of red skin is a symptom of a leakage, and it's important to break the vicious circle and try not to lose the control. So you need to tackle the issue upstream. So ask yourself, why do I have that issue? Hernia could happen around the stoma, sometimes because you're gaining weight or losing weight. Men tend to gain weight on the belly. Women, it takes more time before it has an impact on stoma. So what happens? For example, I began doing an activity I never did before, and I have some reaction in my belly. So this could happen. So try to observe what's going on. Sometimes the children, they simply grow up, or there's pregnancy. So you really have to observe what is going on. Sometimes you will need to change your type of equipment. So, and also measuring the stoma opening. So dermatitis is the most common complication. And it's really due to when you're expelling tools or urine and they come into contact with the skin. So you can always have access with to your stomotherapist, but sometimes the first thing is to try to understand what happened. Did you change company for the equipment or the appliance, or did you change brand? Something has happened. Something has changed. Now, another issue is the fungal infection. So it's always important to find why the reason, the cause of the humidity. Why do you have that infection? Is it because it's summer and it's very humid, or is it because in the morning you're going too fast and you do not dry your pouch enough? There's always a reason why you have fungal infection. Usually, the issue is Candida albicans, and it can be treated with antifungal powder. So you put the cream. Well, it's easier with the powder, but sometimes also the cream can help. Some people will try tinactin, and for some people it worked because the infection was not so severe, and it just dried it out, and then it went away. But if it's really persistent, it won't work because the tinactin can treat a different type of fungus, so it's not appropriate. So the only thing that you could be faced with is hypergranulation. So you see the stoma, you see the blue circle. Well, basically, the patient kept on cutting at the same level, and while the stoma became smaller. So then the body started to produce what we call hypergranulation, and it's painful. So to fix that, um, what I did is I applied silver nitrate sticks. You put that on the piece that is a little bumpy, and it will dry gradually. So basically, you cover the part that is protruding, and you change more often. If you decide not to take care of hypergranulation, eventually the body will produce kind of a hyperplasia, but it's also painful and it can bleed. So again, it's important to reduce the size of the equipment, consult with the stomotherapist, and it's treatable. This happens always because you're too much exposed to humidity. Same thing can happen with urinary stoma. And you will have little white crystals. It's what we call crystal deposits. And it happens when urine is not acid enough. So same thing, you apply some silver nitrate sticks, and you also add vinegar dips. If it's heating a little bit too much, you reduce the dosage, and then you change your equipment. But the purpose is really to make your urine more acid, and you can always consult with your nurse, expert nurse.